King Culture presents A Plan for Longevity, a health and wellness initiative for men. Why health? Why now? At King Culture, we're equipping men to become selfless leaders, and part of selfless leadership is developing a strategy that ensures not only your well-being, but the well-being of those you're responsible for. I'm Dominic Perviance, and on today's episode, we're talking about special care.
Chadwick Boseman, when he passed, that was just like, it was a huge shock because it's also, you see, I mean, he was the Black Panther, right? Yeah. So he's in shape. He's like the model of like, at least put out there as like this strong Black man, hero type person. To see him pass and then connecting dots backwards to how frail he kind of got towards the end when they had some pictures of him, it's just shocking, and it does sober you up to the brevity of life.
We all hope to always live healthy lives. But what do we do when we are diagnosed with a condition or illness that requires an urgent response? In this episode, I'm talking with Corey Brown from Emory Hillandale Hospital to better understand how to advocate for yourself when you find yourself in need of specialized care. You don't want to miss this episode as we map out a plan for longevity. Stay tuned. The King Culture Podcast starts now. So I want to welcome you to the King Culture Podcast. This is part of our Plan for Longevity series, where we are helping to equip men to have a long-term plan that leads to better long-term health outcomes. I'm here today with Mr. Corey Brown, and today we're going to be talking about treatment and specifically surgery. And give you a chance to sort of introduce yourself, tell us a little bit about what you do.
Okay, my name is Corey D. Brown. I'm the nurse manager, specialty director of ambulatory surgery at the Emory Hillandale campus. I have oversight of the operating room, the GI lab, the recovery room, as well as interventional procedures. I've been in the healthcare arena for 32 years. I actually started in the healthcare arena in the United States Army as a combat medic and surgical technologist, and it's been just a rewarding career thus far.
Awesome. And so we were talking a little bit earlier about, one of the number one challenge for men seeking healthcare is number one, trust, probably number two, fear. And so what I hope to get from our conversation today is just a little bit of pulling back the curtain, understanding a little bit about you as a medical professional, how you're thinking about treatment and how you're thinking about treatment decisions and how you manage it, and giving us an insight into how the process works as much as possible. And so I guess the first question I have is, we've talked to a lot of doctors and medical professionals about prevention, about primary care, all the basic maintenance things that you should be doing to prevent, some long-term health issues. But once you've been to the doctor and you figured out, okay, there's a challenge, or there's some either a chronic disease that you have to learn how to manage, or some condition that you have to get treatment for, what's the first thing that you should do once you get that diagnosis, and how should you be thinking about the long-term resolution of the issue?
Right, that's a great question. I think once you're diagnosed with any type of disease process, it would benefit one, meaning the patient, to actually go out and research that disease process, research the trajectory of that disease, determine what type of treatments are best for that disease, determine what type of treatments are offered in your immediate area. Yeah. I would also say reach out to your primary care provider to see what they recommend. And above all, I think it's very important to seek a second opinion. Yeah. In many instances, maybe a third opinion. Yeah. Once you are diagnosed with the disease, there comes a certain level of fear. That's normal. Yeah. There comes a certain level of anxiety. That is also normal. But we must remember that the sooner we can get in in all instances and get that disease process treated, the better off we're going to be and the better the prognosis is going to be.
Yeah.
You know, as Afro-American males, we know we have a tendency to have a high rate of prostate cancer, as well as some colon cancers. So it's very important that we are seeking that preventive care, because that preventive care is going to give us an opportunity to get an early diagnosis. But once you are diagnosed, it's very important to follow up with your provider.
Yeah.
Get on the internet and go to some real good internet sites that are credible to try to determine what is the best treatment for me. The best treatment for patient A may not necessarily be the best treatment for you.
Yeah.
I would say, you know, do your research. Research the hospital. You can go on Health Grades. There's several different sites out there where you can grade. You can grade, actually, see how the healthcare facility was graded.
Yeah.
When you're choosing a proceduralist or in my area a surgeon, research that surgeon.
Yeah.
Sit down and have that critical conversation with that surgeon to ensure that he's board certified.
Yeah.
You want to know how many of these procedures have you done? What are your outcomes?
Yeah. So I guess what I'm hearing from you is, once you have a diagnosis, do your research, almost in every area, about the disease itself, about the treatment, about the hospital, the medical professional that you're seeing to get the treatment. So the more informed you are, the better you're going to be able to manage either the anxiety or the fear, or in some cases the distrust that may exist between the patient and the doctor. One of the questions I had was, you know, a lot of us, when we get a diagnosis, or even before, when we have some kind of we notice some health issue, first place we go is the internet, and we're trying to get as much information as we can. And sometimes that information is good and sometimes it's bad. Like, where can we go, or how can we at least ensure that the information we're reading on the internet is accurate information and that is helpful in understanding our treatment?
I think you should go to internet sources that have a history. You can actually go to, in this case for Emory, you can actually go to the Emory website and really see what corresponds to your disease process. Look at some of the recommendations that they have. Some hospitals, such as Emory, where you have specialists, some of the best specialists that are world-renowned.
Yeah.
You can also go online to other credible sources such as PubMed. You go on that site and just put in your disease process and just do your research. Look for a quality website that doesn't have misspelled words.
Yeah.
Look for a quality website that has been updated within the last 30 days.
Yeah.
So you know, technology and the treatment for the disease processes are constantly changing.
Yeah.
You know, as science progresses, so do the treatments.
Yeah.
So you should be constantly researching and learning more about your disease process, what type of treatments you can undergo to help reverse or at least slow down the disease process that you've been diagnosed with.
Yeah, so let's go back for a second and talk about the actual diagnosis of an issue. Just from my experience, it seems like it's a science, but part of it is an art. Part of it is a process of elimination, where you're trying to figure out, you know, patient has symptoms, okay, where are these symptoms coming from? And it's not always easily to identify what an issue is.
Right.
So can you provide any insight into how a medical issue is diagnosed? What is the process? Sort of like seems like a process of elimination sometimes.
With any diagnosis, it starts in the preventive mode. That's the best way to discover it. By going out and having that relationship, seeking that care, getting that care from your primary care provider, not utilizing for the most part the emergency department
It's come out over and over.
As your primary care provider. Once you're diagnosed with a disease, it's very important to actually, once you are diagnosed, establish that relationship with whoever you choose to treat you. Establish a good relationship, do your research, educate yourself. The best advocate for you is going to be yourself. You also have to be mindful that when you do have that one-on-one conversation with the healthcare provider, if you don't feel comfortable with what's being recommended, seek care somewhere else or ask questions, because at the end of the day, it's your body.
Yeah. You mentioned prevention is sort of the best place to sort of to get an early diagnosis on a patient, especially if you're seeing a primary care doctor. They're seeing you all the time. They're able to, you're doing annual blood work. They're able to pick out, what's going on with you. But say you have a patient that's come to you, and say it's going to a specialist, and they have all of these symptoms, and you're trying to figure out, okay, what's driving the symptoms, and then how do I diagnose it, and then how do I figure out a treatment? What's the process that a doctor is going through? How are you checking off the list to figure out, okay, it's not A, it's not B, it's C?
Right.
That's the issue.
The processes that I've observed that have been used by doctors is they usually they give you a battery of tests. They test your blood. They do what's called a biopsy, where they actually go in and they take samples of the tissue that is either irregular in feel or irregular in appearance, and they do a biopsy to determine whether it's cancerous or whether it's benign.
Okay. Now, biopsy is sort of just a test of the tissue to see.
Yes, a biopsy is a process where you go in and you take just a small sample of a nodule or of a mass, and you send it to the laboratory where it can be studied to see if there are abnormal cells, and the abnormality of those cells are going to determine whether or not it's considered cancerous or non-cancerous. And based upon that, a diagnosis can be made based upon that biopsy.
So you're gonna do blood work. If it's something that may be potential cancerous, you're gonna do tests like a biopsy. You're gonna do images.
Yes, you can have an MRI. You can actually have a CAT scan, and if you don't mind me saying, a real close friend of mine, one of my leaders that I've known from my days in the military, he's recently been diagnosed with an incurable brain cancer. Just to share, he went to bed one night, woke up the next morning and couldn't speak. Just to give you an example, he went to his primary care provider. The primary care provider initially thought that he had a stroke. Then they went in and they did an MRI, and it was determined that he had a mass on his brain. So, it's got to be a certain level of expertise that proceduralist or doctor has to determine if it's not illness A, then what's the next step I need to take in order to determine what is going on with the patient. And actually that MRI, per my friend, he had already went outside to his car thinking that he'd had a stroke, and they stopped him, come back in, we just picked something up on the MRI. And that's just, it's you gotta ensure that you're somewhere where they're capable of doing these tests, where they're capable of doing the tests, where you're going to get feedback on that test, and where you're going to have someone to actually give you feedback in reference to your disease process and make those recommendations for you.
Yeah, I think maybe it'd be helpful to know that, there are a lot of things that you just can't diagnose just by going to see a doctor and just having a conversation. Like, you have to do some actual tests. And so if you're feeling a symptom, you go, see Dr. Google, and he puts you in the grave and prematurely. You have to really wait until you do the investigation. It's just like, like any kind of investigation. You look at the facts, you look at what all of the information tells you before you determine what actually the issue is, and then you figure out what the treatment is. Because a lot of times, you feel things in your body, and some of the fear of going to see a doctor is you may find out that you know, it is something incurable. You hear bad news and you don't want to hear it. And so a, a lot of times it's sort of, you just wait until you have all the tests, you have all the information before you actually determine what's really going on with you.
Right, that's a good point. Basically, what you want to do, you want to have all the preliminary tests that's recommended, and at the conclusion, and once those tests have resulted, then you can make an informed decision of what path you want to take. What path you want to take. You may question the provider, you know, to just give you feedback on, you know, what's the success rate of if we utilize treatment A versus treatment B or C. You also want to take into consideration, you may already have underlying other health conditions that may prevent you from going down the road of taking treatment A versus treatment B. So those are some things that we have to take into consideration. And I think, speaking of the males, just in our community, when I say our community, the Emory Hillandale community, you know, the Afro-American males, we have a tendency to avoid health care. We avoid health care, and we have a tendency in this community to utilize the emergency department as a primary care provider. We should be at home, you know, noticing any changes in our skin. We should be actually, you know, everyone talks about breast exams, but males should be doing breast exams also.
That's something I haven't heard before.
Yes, males should be, you know, examining their breasts for lumps and so forth. Males should also be doing testicle exams.
You talked a little bit about that. What should you be looking for?
Well, with the testicle exams, you want to actually, you know, I'm not an expert per se, but you can actually go to websites. When you go to your primary care provider, you can actually ask them, you know, what can I do as self-care at home? You know, how can I examine my breast? How can I examine my testicles to ensure that I don't have any lumps or bumps? That is something that you can do on your own, self-care. I think when you go in and you're armed with the knowledge of what type of disease processes usually is going to impact me due to my race or my ethnicity, you should be prepared with questions to ask your primary care provider questions around those disease processes. As for instance, as a colonoscopy, it's recommended that you get a colonoscopy by the age of 45. Now, however, if you have a family history of colon cancer, this is something that you want to bring to your healthcare provider's attention. Hey, you know, my grandfather, you know, died from colon cancer. My father had colon cancer. So, you know, you have a genetic predisposition to develop colon cancer. So that's something that you would have your healthcare provider test you for. And I think a lot of times it's very important to know your family history. Your family history is going to be a guide to what you're predisposed, what you have a predisposition to get.
So I'm gonna go back to something you mentioned a second ago. We were talking about the way you diagnose issues. Obviously, you're doing blood work. You're doing imaging. So when you say MRI and CAT scans, and all of those are just images of different parts in the body, and they work to pick up different things to diagnose different issues. You also talk about learning your family history. That's sort of a part of it. So if you're a doctor and you're looking at a patient that shows symptoms in a certain area, and they have a family history that's of certain diseases that are connected to those symptoms, that's just adding layers of information that helps the doctor diagnose what the issue is. The other thing that I think may not be as well understood is how dependent a doctor is on the information the patient provides to the doctor. And so if you're not forthcoming, if you're not, honest, it makes it difficult. Or if you don't feel trusting or comfortable enough to share all that information, they may not be able to have enough information to properly diagnose you. So can you talk a little bit about that, and what role does the information the patient provide to the doctor play in his or her ability to properly diagnose the patient?
The information that the patient exchanges with the provider or in my case, well, the surgeon, is very important. You may be taking aspirin, for instance.
Yeah.
You may be taking you haven't been received a prescription for aspirin, but you just may be taking a aspirin on a daily basis just for yourself to decrease your chances of having a stroke or heart attack. And if you neglect to tell the provider that information, you can go through the preoperative phase. We can actually get you into the operating room, and then you just have excessive bleeding because we wasn't aware that you were on an aspirin regimen.
Yeah.
So the exchange of that information, as well as your diet, as well as your alcohol intake, as well as your tobacco use, things like that are very important. That healthcare provider knows what's going on with you, so that they can navigate and provide a plan for the best course of care for you.
Yeah, and I remember, just a personal note. I went to see a doctor because my heart rate was very high, and I neglected to mention that I had tried this new energy drink that I hadn't tried before, and they's like, don't do that again, and sort of sent me home. But things like that, like all the things that you're doing, even if you're taking drugs or you're doing things, that the doctor needs to know that in order for them to really figure out what's going on with you.
Yes. We've gotten patients in, and if it's determined that the patient has been using, just for an example, just cocaine or crack cocaine, the anesthesiologist may at some point decide, well, right now, if this is not an emergency, we're not going to do this procedure because it can lead to heart problems.
Yeah,
you could get in the operating room, and during the procedure you could have a heart attack. So you gotta. I'm going to back up. A part of that trust, once that trust is established, that patient is going to feel more comfortable sharing that information with you. So, as providers, that's why it's important that we have providers from different backgrounds, from different nationalities. That we're all inclusive.
Yeah.
A patient may feel comfortable talking to someone that looks like them, that's from the same geographical location that they're from. So things like that are very important. You have to have that connection. The provider has to be able to connect with the patient sometimes in an attempt to draw that critical information from the patient.
Yeah, and that's hard because a lot of doctors are trained medical professionals. They may not necessarily have the best people skills, and so it is something you said earlier. Is always incumbent upon a patient to be their own advocate and to make sure that they are, if the doctor may or may not be prepared to, get the information out of you, you have to be prepared with a list of questions, being able to give them all the information that they need, because they are qualified to make the decision, but not all of them, we human beings like everyone else may not have the skill to extract the information they need from a patient. And so it seems like, going back to what you said, you have to be equipped to be able to, be your own advocate.
Yes, you have, I think, the most important thing is to advocate for yourself.
Yeah.
And not only that, but know your body.
Yeah.
Know your body. Know if you usually get 8 hours of sleep a night and you wake up and you feel energetic, now all of a sudden you're getting 8 hours of sleep and you're just not feeling yourself.
Yeah.
You gotta know your body. If you notice that you got a lump that's been on your chin for 2 or 3 years, then all of a sudden it has discharge. All of a sudden the color changes.
Yeah.
All of a sudden the texture of it's changing. You got to be able to bring those changes to someone's attention.
Yeah, I'm glad you mentioned that. So we talked to a mental health expert, and he was saying that how you know when there's an issue is because everyone has a baseline of how they function, the things they enjoy, things they do, habits. And anytime there's a change in your baseline, then that's an indication that there's something wrong. But the same is the case with your body. Like there may be some things that, you may not be able to put your finger on it, but
Right.
something changed. Like
Right.
I feel different,
Right.
or this part of my body is doing
Right.
something that it normally doesn't do.
Right. It's almost like if you notice a change in the size and shape of your stool.
Yeah,
That could be an indication that there's some colon irregularities
Yeah.
going on. So your urine.
Yeah.
If you feel like you're having adequate water intake, but your urine is still dark colored, then you may want to let your healthcare provider know about
Yeah.
that.
So this is basic. You need to be examining. Don't just like go forward in life and not looking at what's going on. And
Yes, you should be very observant of your body. You're kind of like, as the individual, you got to equip yourself, become knowledgeable of, first of all, what your history is, what you're at risk for developing.
Yeah.
What from a genetic standpoint, what do you already have a high incidence, and what are you predisposed for?
Yeah.
Those are some things that you must do. And I think all in all, once you get that diagnosis, I think you should do your research. As I mentioned earlier, get a second opinion.
Yeah.
Don't just settle for what you're told initially. Get a second opinion.
Yeah, go back to, so it's a great segue into going back to talk about treatment. Like once a doctor has done all the research, they've gotten all the information, they've looked at the blood work, they've looked at imaging, they've got information from you, looked at your family history, they figured out there's an issue. Can you provide any insight into how they determine treatment? How do they determine what's the best treatment for this particular patient, and sort of how they provide that information to the patient? Because normally it's their options, right?
Right.
So you can do A or you can do B,
Right.
and they have a preference or recommendation.
Right. The best treatment should be based upon what's the best evidence-based research available. If the evidence shows, by evidence, I mean that there have been scholarly studies that have shown that if you have colon cancer, then we need to do a colon resection or whatever the case may be. The doctor needs to provide that evidence, that best evidence available to the patient, and not just the doctor making the decision, but jointly that the provider and the patient should sit down and determine what's the best course of action. In many instances in the operating room, someone may opt for a laparoscopic procedure versus an open procedure.
No, what's the difference?
Well, the laparoscopic procedure is going to be less invasive.
Okay.
It's going to give you a decrease in your recovery time.
And so that's when you're sticking,
Yes,
you're just a small incision,
right.
you stick a hole
Basically,
in the
what you're
camera.
doing, and it's for the abdomen.
Okay.
We also you're gonna inflate the abdomen with nitrogen, and you're gonna go in and you're going to look through a scope that's going to show on a monitor. You can see the various organs inside the abdominal cavity, and a skilled surgeon can go in and they can really remove anything that's abnormal through small incisions in the abdomen, which is going to give you, it's going to be less traumatic to the body, and it's going to enable you to heal easier.
Versus just cutting you
Right.
all the way open.
Versus making a long incision into the person where you got to go into the different layers of skin, and that's going to actually increase healing, and it's going to be more traumatic to the body.
Yeah.
So, but in some instances, for instance, I can give you an example, and I hope she doesn't mind me mentioning this, but my spouse, a while back, she needed a hysterectomy. She went to several doctors, and I actually got a chance to look at her films on the fibroids that she had. And just based upon my experience in the surgical arena, I said, well, honey, there's no way you're going to be able to get this done laparoscopically. So she went to several doctors, and they was like, oh, I can do it laparoscopically. So I sat her down and I had a conversation with her. I said, sweetheart, this is how I view this. You're being told that this can be done laparoscopically, but what's going to happen, you're going to get into the operating room, and you're going to be at risk because it's going to be an increased chance that they're going to have to open. Mm-hmm. So I did my research, and I found a surgeon that was within the Emory network, and she told my wife right off the bat, I would never attempt to do this laparoscopically. Needless to say, she did the procedure on my wife, and it was uneventful. So, a lot of it too depends on, like I said, not just taking that first opinion, seeking that second and sometimes that third opinion. Because I say this cautiously, but sometimes is the antiquated way of doing things based upon your anatomy and disease process in some instances may be the best course of action.
Yeah. So I'm glad you mentioned this. So what I'm hearing from you is, if you're a patient, the best thing that you can do to be best equipped to evaluate recommendation from a doctor is get a second opinion.
Yes.
As well as do your own research to make
Correct.
sure that's the best treatment for you. Can you? I know your expertise is in surgery. Can you just broadly describe, it may seem really trivial, but just what is surgery,
Okay.
and what are the type of issues you would need to that you would need to treat with surgery?
Okay. Basically, surgery for the most part, the patient will usually be diagnosed. There's a diagnosis made. There's a determination made by the surgeon that the patient is going to need to have surgery. The patient usually comes in 48 to 72 hours prior to that surgery. They get an examination by a preoperative nurse. That nurse will get a baseline of the vital signs, write down any acute disorders that the patient may have, things such as high blood pressure, diabetes, any problems that they've had with surgeries in the past. The anesthesiologist in most instances will also see that patient, take a look at the airway, then determine whether the patient is going to be a high risk anesthesia patient. The patient is also educated at that time of what medications should be taken, what medications should not be taken. Obviously, if it's an orthopedic case where we're going to be doing a total joint replacement or something like that, we're going to give that patient a special type of solution to take a bath in the day before to make sure that we kill all the microorganisms as much as we can to prevent an infection when we actually enter into the operative phase. Once the patient presents to the facility on the day of the surgery, that patient is going to be worked up again by a preoperative nurse. That preoperative nurse is going to do a comparison of that baseline data that they came in 48 to 72 hours and to ensure that everything is still within range. Any antibiotics or anticoagulation that the surgeon has ordered will be given at that time. The patient then will be taken to an operating room where the patient will be positioned, the type of anesthesia, and in many instances, it would either be a mic or general. When I say mic, it's just it's just conscious sedation. You're not all the way out, but you're asleep and you're comfortable. With the general surgery, you actually have a tube that's put down your throat so that your airway can be controlled and so that you won't have the pain sensations during the surgery itself. And it's really complex because behind the scenes you have a SPD technician that has ensured that the instruments are sterile. You have an operating room nurse that's going to be in the room, and that operating room nurse is going to has a real big responsibility, because in many instances that operating room nurse is going to have the anesthesiologist vowing for their attention. It's going to have the surgeon vowing for their attention, as well as the surgical technologist. But that operating room nurse has to be an advocate for the patient. Mm-hmm. That operating room nurse has to prioritize who needs to be cared for first. And after the surgical intervention is over, is the recovery phase where the patient goes to the post-anesthesia recovery unit. During that phase of the process, the patient's baselines are once again compared to those initial baseline scores to make sure that the patient's within the normal ranges. The patient is once the patient has an opportunity to be deemed by anesthesia to go to the next phase of recovery, Then the patient it goes to the discharge area where there's education given, family members called in, and then the patient is able to be discharged either to the ICU, one of the floors, or if it was a minor procedure, the patient is discharged to home.
Okay, that's pretty good.
Yes,
Pretty good
yeah.
explanation.
Okay.
So it's
Well, that's kind of like my that's my specialty.
yeah.
So
And so there's a lot of pre-work for at least 48 hours
Yes.
before that gets your baselines.
Yes.
Then you come in and do the procedure. And during the procedure, there's your anesthesiologist. That's the person that's going to
intubate. Yes.
And that's your pain medicine as well as if you're being put out
Yes.
for surgery, they're going to
Yes.
do that.
And what's so important, if you were to just go and look through the doors or the windows of the operating room, it's like they're
team.
dancing. It's a team effort. It's
Yeah.
like they're in concert. Everybody knows their role, and when everyone performs their role the way that it's supposed to be, that ensures that we have a safe patient outcome. And one of the key things in the surgical arena that I find is communication.
Yeah.
You got to constantly communicate with one another. Just to go a little further, I've had the opportunity, as I said earlier, to be a surgical technologist as well as now operating room nurse. And when I trained as an operating room nurse, I was taught that you utilize all of your senses to protect your patient. And how I say that, you're listening for the anesthesia monitors. You're sensing how cold it is in the room, and you're also looking. And I was taught just that from the very start, to utilize all your senses to be an advocate for your patient.
Yeah. I think that's important because when you're out, you're really putting the trust of
Yes.
your life into
Yes.
all of these people, and you can't advocate for yourself at that point.
I'm a little biased. I feel that the operating room team, that's the most vulnerable that an individual can be.
Yeah.
And I think it's very important that the people that are providing care for you are skilled, that they're educated, that they're compassionate, and above all, that they're advocating for what's actually best for the patient.
Yeah. How can I be comfortable if I'm going in? What are the
For
things
surgery.
for surgery that
Right.
I'm looking at? What are the things that I need to know and that I
think-
need to have to be
Right.
comfortable?
I would use this as an example. If you're having a total knee replacement, I think what you should do, you should go out and research total knee replacement. Write down some questions that you have about total knee replacements. Also, go to healthgrades.com, and if you're having your procedure done at a particular hospital, look at what their results are as far as total knee replacements. What's their infection rate? Also, research the hospital.
Yeah.
How many procedures at this hospital are being performed annually?
Yeah.
What are their infection rates? Those are some of the things, what's the recovery rate with this surgeon?
Yeah.
How many has the surgeon done? What technique is the surgeon using? Those are some of the things that you're going to ask. What my recovery time is going to be? Those are some of the things, and above all, you want to make sure that you know what questions to ask when you go to the surgeon.
Yeah.
Ask those questions, do your research, and also inquire about the long-term benefit, the risk versus the benefit.
All right. What kinds of things require surgery? I know that's a broad kind of spectrum of issues. So there's skeletal muscular issues, there's cancers.
Okay.
Is there sort of some broad categories that we should be thinking about?
Surgery can be utilized, like as you said, when there's an abnormality of the skeletal system. Surgery can also be utilized when there's an abnormality of the respiratory system. In many instances, just to go back based on my experience, I know she's going to love me for doing this, but my wife who's an avid jogger, she was out running one day and her lung collapsed on her. She had what they call blebs, so she had to go in and have surgery. And the thoracic surgeon went in and put in a type of I can't really think of the name of it, but he actually went in and scrubbed the side of her lungs, and based upon that, she hasn't had any more issues with it. And additionally, you can also be required to have surgery when there's a abnormality with some of your internal organs. And a perfect example is if you got a spot based upon an MRI on a kidney. A biopsy can be done. It can be determined that, well, hey, we caught this early enough, you have kidney cancer, and then they go in and remove that. But surgery it shouldn't be taken lightly.
Yeah.
In most instances, from what I've seen, when the surgeon interacts with the patient, they also go over all the alternatives. A lot of surgeons will use surgery as a last alternative.
Yeah.
Now, that is different when you're in a trauma or a life-saving situation.
You just got to do it.
When you're in a life-saving situation, then you got to bring that patient to surgery immediately. You really don't have a good grasp on, in many instances, of their history, of their health history, but you have to do what is deemed necessary to either save life or limb.
Yeah, and it's more risk, because if it's an emergency situation, you don't have history, you don't know what else is going on with the patient. So, and the patient may be incapacitated, they don't have the ability to tell you.
Yes, correct.
So you have to really make that decision for the patient.
Correct.
And so surgery, just to piggyback on it, to go back to it for a second, so you're either removing something that doesn't need to be there, you're fixing something that needs to...
Yes, fixing, and in many instances, you're actually, you can be removing a organ that is not functioning properly and replacing it with an organ from someone else.
Yeah.
That's, and it's just amazing. At my previous facility where I worked at when I was in California, we were doing kidney transplants, like 3 and 4 a day, so, you have your donor and then you have your recipient, and that actually, by virtue of getting that organ transplant, that's going to increase someone else's quality of life.
Yeah.
Additionally, if someone is extremely obese, which obesity is one of the things that we have going on in America right now. A lot of people are overweight, and this COVID hasn't made it any better.
Yeah.
You can actually go in and have a surgical procedure to reduce the size of your stomach, and therefore it results in weight gain, and not weight gain, but it results in weight loss, which is going to give you a better quality of life.
Yeah.
Yeah,
and there's some, like in those instances, that's when it's a medical reason why you need to lose weight, not just because you just
right, not just on a whim, but when the obesity is to the point where and you've tried to lose the weight on your own, so it's a necessity for you to get the procedure in order to lose that weight.
And I guess that sort of brings me to the last question, like, because surgery is such a major type of treatment, and hopefully you live your whole life and you never have to have it, but it seems to me that doctors view surgery as a last resort.
In many instances.
Right.
Now,
if they can figure out any kind of other treatment besides that solves the problem, do that. I've never had any doctor that I've seen, they never, like, the first thing they said, unless it's life or death, they never say you should get surgery. They try to figure out what to do first before you do something that extreme.
In many instances, after all the other treatment methods have been exhausted, then surgery is recommended. Now, I will say, and I love my plastic surgeons dearly, sometimes when we're having plastic surgery done, it's not necessarily is done for a life-saving reason, but it's more been done for cosmetic and appearance and things of that nature. But some may choose to have the plastic surgery because it may help them with their self-esteem, or if they have a job where the appearance is considered, very important, then they may choose to go the plastic surgery route. But I just want to say, at the Emory Hillandale campus, speaking of surgeons, we have a wealth of excellent surgeons, and we provide a service to the community. But like I said, when a person needs surgery and they come into the operating room, I think that's one of the most vulnerable times for the patient.
Yeah, and I think, we started this conversation talking about the lack of trust and fear, and I think you've been very helpful in sort of pulling back the curtain, helping us understand, if you have to have an extreme treatment like surgery, what you need to know,
Right.
what the process is like, and how you can be best informed.
And I can tell you just based on my practice, when I get an opportunity to actually go in the operating room and function as a nurse, I make it a habit, especially if it's going to be a general anesthesia. I try to make it a habit of walking up to the patient and holding that patient's hand.
Yeah.
You know, because they're getting ready to go off to sleep. Hold their hand. You know, I just feel that just by me providing that touch and making that connection, and a lot of times they wake up and they still remember me because I was the last voice they really heard, other than anesthesia, prior to going to sleep. Yeah. But it's just the little things like that. And actually, I've even had surgery in my own operating room. I'm not that, you know, but I was, you know, just so you know, I was in the gym one day and I was lifting. It was chest day, and I actually tore one of my pecs. Yeah. And you know, I was very confident in the team that I work with daily, and I had my surgery over at the Emory Hillandale campus, and it was successful.
Yeah. Awesome. Well, thank you. I appreciate it.
All right. Okay.
Thanks for listening to this edition of the King Culture Podcast. For more information on a plan for longevity, visit us online at kingculture.org and fill out your personal health inventory. Follow us on social media at King Culture Inc. And don't forget to like, comment, and subscribe.